anesthesia always required for dental treatment?
Not always. It depends on how brave you are. If you want to tough it out, we can have a go. But if you want to feel no pain, then local anaesthetic is your best friend. There are some procedures that don't require local anaesthetics. For example, if you need a scale and clean, most people don't need any form of anaesthesia. If you have a small filling and you want to give it a go, then you probably won't feel much. But if a filling gets deeper, if you need surgery, if you need your wisdom teeth removed, if you need implants, then I would recommend local anaesthetic so that you don't feel a thing.
What is the difference between local anesthesia and general anesthesia?
Very simple. Local anaesthesia is localized to your mouth, to the area that we're working on. It numbs your teeth, numbs your gums, numbs your tongue. You don't feel any pain, but you're still aware. You are awake. You will feel vibration. You'll hear all the noises. We can talk. You can talk back to me. I can talk to you, but you feel no pain. And if for whatever reason it hasn't worked very well and you feel an occasional twinge here or there, you can let me know and I can always top up. Now, general anesthesia, on the other hand, is completely different. You are asleep. People who are very anxious require general anesthetic. Sometimes they can't tolerate any treatment under local anesthesia, even if there is no pain. So for those patients with severe dental phobias, I recommend general anesthesia. However, there are also patients who are not anxious, yet they need an extensive surgery. For instance, bone grafting, if they need lots of implants, if they need all on four, then it's generally advisable to have general anesthesia for that so that the procedure is more comfortable for you. They're long procedures. To stay in the chair for 3, 4, 5 hours sometimes is very difficult for anyone.
Do you offer general anesthesia and can be done for any treatment?
We absolutely offer general anesthesia, not myself. You don't want me to do any form of anesthesia for you other than simple local anesthesia, but we do have a visiting anaesthetist who is qualified, trained, and can deliver it very safely. At Dr. Helen's Dental Studio, here at our room, so you don't have to go anywhere else. So the service is provided here. Can you have general anesthesia for any dental procedure? Absolutely, you can. You can have it for a scale and clean, you can have it for a checkup. The only problem is it's going to get very expensive for you. To put you to sleep, to recover you safely, to keep you under general anesthetic for the procedure, the anaesthetist will charge you an hourly rate. So for simple procedures, it's probably more cost effective for you to have either local anesthesia or none at all, depending on what we are doing. But if you have a severe form of anxiety, then we can discuss what the best option for you is. But yes, you can have it for pretty much any procedure.
Let's talk about numbers. What could be the cost for general anesthesia?
So the cost of general anesthesia, it is not cheap, but the good news is you get a Medicare rebate for part of that overall cost. So to give you some ballpark figures, anaesthetists will charge, and look, it will vary from one anaesthetist to another, but ballparks are the first hour could be around $1,800 to $1,900, and then subsequently most anaesthetists will charge in around about $800 an hour. So it depends on the length of the procedure. They will also charge you for the time that it takes to put you to sleep and the time to recover you safely, and that could add another, let's say 1 hour to the overall duration of the procedure. Fillings, maybe some fillings, maybe a clean, maybe a couple of crowns might take a few hours. If you have all-on-4 surgery, it might take 2, 3, sometimes 5 or 6 hours. Bone grafting can be involved, multiple implants can be involved, veneers and crowns can be involved. So it adds up, and you are charged for the time rather than for the procedure itself. But the good news, as I mentioned earlier, once the procedure is done, Our anaesthetist will itemize it for Medicare, and you can take your receipt to Medicare to get a pretty much instantaneous rebate. What could that rebate be? For smaller procedures, it could approximately be a third of the overall cost that you get back from Medicare. For bigger procedures, longer times, your overall fee might be $5,000, $6,000, sometimes even more than that if it's a longer procedure. But Medicare will pay maybe $3,000 to $5,000 back to you. Once you reach your safety net, Medicare safety net that is, then you get a lot more back from Medicare. And another interesting factor is if you have to have multiple surgeries in one calendar year, for the second one you will get a lot more back, almost in some cases 80% of the overall cost, and that's simply calculated by Medicare once you reach your safety net.